Today, viewers, welcome back to DDM House News Update on our program, Your Health, Your World. Guys, I often remind you guys to subscribe to our YouTube channel that's in Dashboard Digital Media so that you get the latest on health. You get what's in time, how you can take good care of your health. Well, so what do we have today? Researchers at the Nigerian Institute of Medical Research have found that non-adherence to antiretroviral drugs could be reduced if patients living with human immunodeficiency virus, that is HIV, benefit from some form of economic empowerment. Well, the inability of patients to take their medications as prescribed has been identified as a significant problem in HIV and AIDS management, resulting in viral suppression failure, drug resistance, and treatment failure. You can imagine. In Nigeria, HIV is still a major public health problem, with about 2 million Nigerians currently living with this infection. How many are we? Well, a new survey by the National Agency for the Control of AIDS, that is NACA, indicates that Nigeria has an HIV prevalence of 1.3%. NACA notes that Nigeria has the highest number of people living with HIV in West and Central Africa. My God. But presenting the pilot study by NIMR's Grants Monitoring and Evaluation Unit, Dr. Kazim Osulale revealed that little attention has been paid to empowerment intervention, especially in the developing world like Nigeria. The study is titled Empowerment Models for Improving Human Immunodeficiency Virus Patients' Adherence to Antiretroviral Drugs. Osolele, a senior research fellow at NIMR, observed that while several methods for improving adherence to ARTs, such as directly observed therapy, dose simplification, pull reminders, and counseling, among other strategies, have been published, little has been done in terms of HIV patients' empowerment. You can imagine. In Nigeria today, poverty remains a grave concern as large segments of the population are poor in both physical and economic terms. Oh, haven't you observed that? Well, also speaking, the experts added that economic hardship limits access and commitment to ads, thus finding solutions to non-adherence caused by inadequate or non-regular income by patient could improve adherence to picking up and taking medication as and when due. Yeah, this is critical, as the need to feed, transport, pay for registration fees at the clinic, and other financial challenges are attached today, even if the drugs are given free of charge. Yeah. Also, Lele disclosed that the study, which was conducted between July 2021 and February 2023, was designed and evaluate the impact of skill acquisition empowerment intervention on ARTS adherence among HIV patients in Nigeria. According to him, the objective was to determine the significant differences in adherence rate before and after the empowerment intervention for the experimental group and the control group, and also to compare ARTS adherence of HIV patients who participate in the skills acquisition program and ARTS adherence of a group that does not participate in the program. So we're going to calculate all these. The pilot study involved 50 willing patients aged 15 to 45 years who have been on antiretroviral therapy for at least 3 months at NIMR's HIV care and treatment center, and with documented adherence between 95%. Participants were grouped in either the experimental or control groups. The skills acquisition model as a piece of empowerment program was in 2 phases. During one phase, we had over 4 lectures, and in phase 2, we engaged in practical vocational training that involves catering, bead making, lipid soap making, and hair knitting. The participants received startup materials just after the skills acquisition program, and they were followed up over 3 months. Yeah, that was what the senior researcher said. He also said that while there were no significant differences in the 2 groups of participants in areas such as age, marital status, occupation, level of education, researchers, well, However, researchers observed a significant difference in the monthly income between the experimental group and the control group. Well, according to him, while 16 out of 25 participants have their income between 0 to 15,000 naira in the experimental group, only 8 of the participants in the control group have income between 0 to 15,000 naira. You can imagine. He also revealed that there was, however, no significant difference in the source of income between the two. That's the two groups. Osulale presented the findings of the study showing that the experimental group, which had access to empowerment alcohol, recorded better adherence to ARVs than the control group. If you look at the experimental group, which is having 0.25 before the intervention, the range was between 27 and 92% of adherence. Now, for the control, before the intervention is between 39 and 92, and the mean is 83.66. And after the intervention, it is 99.44. Meanwhile, if you look at the experimental group, it increases from 68.76 to 109. You can imagine. The adherence rate increased. It supersedes that of the control group. Here, they comparing the two groups, experimental group and control group. If you look at the experimental group, the range of 27 to 92 and the mean is 68.76. For the control group, between 39 and 92 and the mean is 83.66. You can see the differences. So, if you look at that of the experimental, it increases from 68.76 to 109.76. Yeah. So, the experimental group surpasses the control group in terms of adherence rates that we have, which is very significant. Yeah. If you're good in mathematics, you really understand what I'm talking about. But to compare the experimental and the control before and when you compare the experimental group and control group, post-intervention, which is 0.044, is also significant. This study confirmed that effectiveness of skill acquisition is improving as adherent. Yeah, economic empowerment directly address barriers such as transportation costs and financial stress, enabling consistent medication use. Osolele, however, acknowledged the limitation of the study due to its small sample size, which could limit how widely the findings can be applied, and also its short-term follow-up of about 3 months, which makes it impossible to assess the intervention's lasting effects. He also recommended future research with larger samples and longer follow-up period, which will help those in retroviral drugs. Next, the Director General of the World Health Organization, Dr. Tedros Ghebreyesus, announced on Monday that the mpox upsurge continues to meet the criteria of a public health emergency of international concern, as set forth in the International Health Regulation. The announcement follows the first meeting of the IHRA Emergency Committee regarding the mpox upsurge held on 5th June 2025. A statement from the Global Health Body noted that the committee, recognizing progress in response capacity is in certain countries, advised the Director General that the event continues to constitute a FINEC based on the continuing rise in the number of cases, including a recent increase in West Africa, and likely ongoing undetected transmission in some countries beyond the African continent. To be honest with you, the increment of mpox is high this time around. If you're a victim, try to meet a specialist so that you get better. If you're not, please avoid those who are affected by mpox. It's a very deadly disease. Please take note. Mpox is not a funny disease. If you're already a victim, have hope, have pressure that you will get better. But when you do that at the right time, there is no time to waste time. Your health matters a lot. Well, with this, we come to the end of today's news on your health. your world. Do ensure to click on the like button, share, comment, and subscribe to our YouTube channel. That's it, Diaspora Digital Media, to get to the latest unheard. Until I come your way, I am Nenor Michaeline Easily. Thanks for watching. Do have a beautiful day ahead. Bye for now.